assessment, and management for shoulder conditions. Before anything else, make sure to do proper aseptic techniques and ensure patient's vital signs are normal. ROM testing. We will assess the shoulder's range of motion, both actively and passively, followed by an end feel test. The goniometer placement for each movement is as follows. Feel free to pause to display normal ROM values and proper positioning. Shoulder flexion. Make sure patient is lying comfortably. This is done actively, then passively. Don't forget to apply overpressure for the end feel. Shoulder abduction. Make sure patient is lying comfortably. This is done actively, then passively. Don't forget to apply overpressure for the end feel. Shoulder external rotation. Make sure patient is lying comfortably. Place a towel under the arm like so. This is done actively, then passively. Don't forget to apply overpressure for the end feel. Shoulder internal rotation. Make sure patient is lying comfortably. In the same way, place a towel under the arm. This is done actively, then passively. Don't forget to apply overpressure for the end. Now, we are going to assess the muscle strength using the manual muscle test. The grading follows the standard MMT scale. Shoulder flexors. Instructions to patient: raise your arm forward to shoulder height. Hold it, don't let me push it down. Grade 3. Completes test range 90 but tolerates no resistance. Grade 5. Holds end position 90 against maximal resistance. Grade 4. Holds end position against strong 2. Moderate resistance. Grade 2. Completes partial range of motion, since this is against gravity. Grade 1. Examiner feels or sees contractile activity in the interior deltoid, but no motion occurs. Grade 0. No contractile activity. Shoulder extensors. Instructions to patient: lift your arm as high as you can. Hold it, don't let me push it down. Grade 3. Completes available range of motion with no manual resistance. Grade 5. Completes available range and holds against maximal resistance. Grade 4. Completes available range but yields against strong resistance. Grade 2. Completes partial range of motion. Grade 1. Palpable contractile activity in any of the participating muscles, but no movement of the shoulder. Grade 0. No contractile response in participating muscles. Shoulder abductors. Instructions to patient: lift your arm out to the side to shoulder level. Hold it, don't let me push it down. Grade 3. Completes range of motion to 90 with no manual resistance. Grade 5. Holds end test position against maximal downward resistance. Grade 4. Holds end test position against strong to moderate downward resistance. Grade 2. Completes partial range of motion for sitting test and full range for supine test. Grade 1. Palpable or visible contraction of deltoid with no movement. Grade 0. No contractile activity. Shoulder external rotators. Patient is in prone. Shoulder abducted to 90 with arm fully supported on table. Instructions to patient: raise your arm to the level of the table. Hold it, don't let me push it down. Grade 3. completes available range of motion but is unable to take any manual resistance. Grade 5 completes available range of motion and holds firmly against resistance. Grade 4 completes available range, but the muscle at end range yields or gives way. Grade 2 completes available range in this gravity-eliminated position. Grade 1 palpation of either or both muscles reveals contractile activity, but no motion. Grade 0 no palpable or visible activity. Shoulder internal rotators. Patient is in prone. Shoulder is abducted to 90 with folded towel placed under distal arm. Instructions to patient: move your forearm up and back. Hold it, don't let me push it down. Grade 3 completes available range with no manual resistance. Grade 5 completes available range and holds firmly against strong resistance. Grade 4 completes available range, but there is a spongy feeling against strong resistance. Grade 2 completes available range. Grade 1 palpable contraction occurs. Grade 0 no palpable contraction. Now for the functional testing. We have 3 testing movements for this. 1 hand to back of the neck. 2 hand to scapula. 3 hand to opposite scapula. This is a quick assessment of shoulder ROM. Uses combined movements to evaluate functional capacity, mobility, and asymmetries. Feel free to pause for the grading of each test. Apley's scratch test. This is a quick assessment of shoulder range of motion. Uses combined movements to evaluate functional capacity. Assesses flexibility, mobility, and asymmetries. Now, let's go through therapeutic exercises for shoulder mobility and strength. The pendulum exercise helps improve shoulder mobility while keeping the arm relaxed. The therapist demonstrates first arm forward and backward for flexion and extension, using the table as support, followed by side-to-side movements for abduction and adduction. Movements should be slow and controlled, allowing gravity to assist. To progress, a light dumbbell or wrist weight can be added for resistance. The wand exercise improves flexion, extension, abduction, and rotation by using a stick or cane for assistance. The patient holds the wand with both hands, using the unaffected arm to guide the movement. They should slowly raise the wand overhead for flexion and move it outward for abduction. For external rotation and internal rotation, the wand helps guide the forearm in a controlled manner. This exercise increases flexibility and restores functional movement by encouraging gradual arm elevation. The finger ladder is used to improve flexion and abduction. The patient stands facing a wall for flexion or sideways for abduction, placing fingers on the ladder or wall. They slowly walk their fingers up, reaching as high as possible, and hold for 7 to 10 seconds before returning to the starting position. This is repeated for 10 repetitions, 1 to 2 sets. The therapist ensures proper form and prevents compensatory movements. Scapular mobilization, upward and downward rotation. To improve scapular stability and mobility, we perform scapular mobilization. The patient should lie on their unaffected side while the therapist supports the affected arm, ensuring relaxation. The therapist then palpates the scapula with one hand while using the other hand to gently guide the scapula forward into upward rotation and downward rotation. This movement should be smooth and controlled, avoiding any excessive force. Perform 10 repetitions for 1 to 2 sets, ensuring the scapula moves freely without discomfort. Peripheral joint mobilization. Peripheral joint mobilization is a manual therapy technique used to restore normal joint mechanics, reduce stiffness, and improve mobility. It is performed using graded, oscillatory, or sustained movements to stretch the joint capsule and enhance movement in restricted directions. Anterior glide. This technique improves external rotation and extension by mobilizing the humeral head forward. Posterior glide, used to improve internal rotation and flexion. This mobilization involves applying a posterior directed force on the humeral head. The patient lies supine. The therapist holds the patient's arm, pushing it down. Inferior glide. This helps increase abduction and elevation by creating space within the joint. The patient is seated, and the therapist applies a downward force on the humeral head. And finally, for strengthening, we will be demonstrating resistance-based exercises to improve stability, endurance, and functional movement. Isometric strengthening parameters for this are 7 to 10 seconds hold, 10 reps, 1 to 2 sets. Flexion, face the wall or table, push against the table or the wall. Extension, face against the wall or table, push backwards against the table or the wall. Abduction, stand on the side of the table or wall and push against it. Internal rotation, flex the arm in 90 degrees and face the wall. Push inward towards the wall. External rotation, stand beside the edge of the wall. Flex the arm at 90 degrees and push towards the wall. Dumbbells can also be used for various upper body strengthening exercises to enhance muscle coordination and endurance. TheraBands offer progressive resistance training, improving muscle endurance and control for dynamic movements, recovery and performance enhancement. External rotation of strengthens the rotator cuff. Internal rotation IR engages the subscapularis, supporting controlled inward movements. Extension activates the latissimus dorsi and posterior deltoid, improving strength for reaching and pulling. Flexion, essential for overhead and forward-reaching activities. Each strengthening exercise should be performed with controlled movement and proper form to maximize benefits and prevent compensation patterns. That concludes our shoulder assessment and rehabilitation exercises demonstration. Thank you for watching.